This year 2023 is winding down and we've been through a lot of ups and downs. But here at Daily Dose of Honest Science, we always look straight forward. And let's have a deep dive into 2024 and maybe some medical revolutions. Oh boy, there's a lot to cover, so let's dive deep into it. I got a breaking news. ChatGPT is going to scan patients for lung cancer. Wait, what? No, of course not. Artificial intelligence has creeped into our lives and has actually changed the medical landscape and the scientific landscape a lot. Oftentimes, patients with lung cancer are diagnosed at stage 3 or 4, and it would be really cool if we could detect it earlier on, so we increase the survival rate of the patients. So a randomized trial in Nottingham in the UK does check with AI if the X-ray scans can already tell you what kind of increased risk, or is there already a lung cancer. And the time of diagnosis with the AI, what they have tested, decreased to 50%. So it makes a huge difference. And they hope that if it significantly improves the lifespan of the people, that we can add the AI into it and do even patient care and also diagnosis with it, and therefore fostering actually a good health system. We know that there is no cure for HIV, but currently we have medical treatments that can slow down or even prevent the disease progression into the very late stages that we know as AIDS. So in the US, we have a yet phase 1 double-blind randomized placebo-controlled multi-center study that evaluates and also tests a vaccine called VIR-1388. And this one is very promising because it could prevent the infection with HIV. So this vaccine actually has a very strong and unique and sustained T-cell response. And this could actually help to prevent acquisition of HIV. And if promising results come out later the 2024, this would have a tremendous impact on the world, and also we would have the first HIV vaccine. The WHO said that about 8.5 million individuals in the world are suffering from Parkinson's disease. It's a neurodegenerative disease that is showing itself in the decline of the motor abilities. And the numbers are rising. Oftentimes when Parkinson's disease is very prominent in the focus, the clinical trials tend to take the patients that already have late on stage of Parkinson's disease. But the moderate ones are often left out. But now, a trial in Sweden does something different. So this trial in Sweden will transplant dopaminergic neurons that are derived from human embryonic stem cells into the brains of the patients, which are between 50 and 75 years old, which have moderate disease of Parkinson. This trial is very important because it's the first time a human embryonic stem cell therapy is tested in PD patients, especially in the moderate state. And the people who are leading the study, they think that this is the best chance to profit from the therapy, and therefore preliminary results are expected at the end of 2024. So this was a little sneak peek in 2024. What was your highlight? What was something that you did not expect? And maybe what kind of medical invention are you looking for? Let me know in the comments, and we see us in the next video.